This video is for educational purposes only and does not replace official training, local protocols, or medical advice. Always follow your specific agency guidelines and medical control. Imagine your brain as a commander sending messages down wires, nerves, to your muscles to make them move. Normally, when a message reaches the end of the wire, it drops off a tiny chemical key called acetylcholine, ACH. This key fits perfectly into little locks on the muscle called nicotinic receptors. When the key turns the lock, the muscle twitches or squeezes. When paramedics need to intubate, the patient's natural reflexes will fight them. They will gag or cough. To protect the patient and pass the tube safely, paramedics have to temporarily turn off those muscle locks using paralytics. These medicines work in two completely different ways. 1. The key jammer, succinylcholine. Succinylcholine is what we call a depolarizing paralytic. Think of it like an aggressive, imposter key. When injected, it rushes into all the muscle locks at once and turns them on. Because it activates everything simultaneously, the patient's muscles will actually twitch all over for a few seconds. This twitching is called fasciculations. But here's the trick. Once succinylcholine is in the lock, it breaks off inside it. It refuses to let go. Because the lock is stuck in the open position, the muscle gets exhausted and completely goes limp. It cannot reset to fire again. Speed, super fast. The patient is paralyzed in less than 60 seconds. Duration short. It wears off naturally in about 5 to 10 minutes because blood chemicals chew it up. 2. The lock blockers, rocuronium and vecuronium. Rocuronium and vecuronium are non-depolarizing paralytics. Instead of turning the lock on, these medicines act like a piece of duct tape placed right over the keyhole. They sit on top of the nicotinic receptors, completely blocking the real keys, ACH, from getting in. Because they never turn the lock, there is zero muscle twitching. The muscles just instantly relax and go asleep. Rocuronium hits very fast, about 60 to 90 seconds, and keeps the muscles relaxed for roughly 30 to 60 minutes. Vecuronium takes a bit longer to start working, about 2 to 3 minutes, but also lasts a long time, around 45 to 60 minutes. Paramedics usually have to mix this one from a powder into a liquid right before using it. Paramedics don't just pick a drug at random. They have to play medical detective within a matter of seconds, looking closely at the patient's history and condition. Paramedics choose succinylcholine when they need a very fast-acting drug that will wear off quickly in case the breathing tube is difficult to place. Contraindication considerations. High potassium. It pushes potassium out of cells into the blood. If a patient already has high potassium, like from severe kidney failure or crush injuries, this can stop the heart. And history of burn/strokes. Older injuries cause muscles to create extra locks, leading to a dangerous spike in potassium. Rocuronium is chosen when a patient has a condition where succinylcholine is dangerous, like a crush injury or kidney disease, or when they need the patient to stay paralyzed for a long ambulance ride. Contraindication considerations. Anticipated: can't intubate, can't ventilate airway. If a paramedic worries they won't be able to get the tube in or breathe for the patient with a mask, locking the muscles down for an hour can be highly dangerous if a backup plan isn't ready. Vecuronium is often used as a backup when rocuronium isn't available, or as a maintenance dose to keep a patient paralyzed after the breathing tube is already successfully in place. Contraindication considerations. Same long-lasting layout risks as rocuronium, plus the extra 2 to 3 minutes it takes to start working makes it less ideal for the initial high-speed intubation. Ultimately, paramedics evaluate the patient's underlying illness, how long the transport to the hospital is, and whether the patient's cells might dump too much potassium into the bloodstream. They balance speed against safety to pick the perfect chemical tool for the job.